Hello viewers, today our video is about very interesting and common topic. What is hepatitis C and how it spread from person to person. If you like our video, please subscribe our channel. What is hepatitis C? Hepatitis means inflammation of liver. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxin, some medication and certain medical conditions can also cause hepatitis. However, hepatitis is often caused by a virus. In the United States, the most common hepatitis virus are hepatitis A virus, hepatitis B virus, and hepatitis C virus. What is hepatitis C? Hepatitis C is a liver inflammation or infection caused by C virus. Hepatitis C can range from a mild illness lasting a few weeks to a serious long-term illness. Hepatitis C is often described as acute, meaning a new infection, or chronic, meaning long-term infection. Acute hepatitis C occur when the first 6 months after someone is exposed to the hepatitis C virus. Hepatitis C can be a short-term illness, but for the most people, acute inflammation leads to chronic infection. Chronic hepatitis C can be a lifelong infection if left untreated. Chronic hepatitis C can cause serious health problems, including liver damage, liver cancer, and even death. Hepatitis C transmission. How Hep C is spread and contracted. If you have just been diagnosed with hepatitis C, you may wonder how you get it and worry about passing on the virus to a loved one. If you have had the disease for a long time without knowing it, you could dwell on every little incident in the past where you might have accidentally exposed your family members to disease. It's important to remember that hepatitis C isn't easy to catch. If you take a few precautions, it's almost impossible to pass the disease to someone else. How does hepatitis C spread? Hepatitis C is spread only through exposure to an infected person, blood. High-risk activities include sharing drug use equipment, anything involved with injected street drug from syringes to needle can have small amount of blood on it that can transmit hepatitis C. Pipes and straw to smoke or snort drug can have blood on them from cracked lip or nose bleeds. Get into a treatment program if you can. At very last, don't share needle equipment with anyone else. Sharing tattoo or piercing tool, non-sterile items and ink can spread contaminated blood. Blood transfusion in countries that don't screen blood for hepatitis C. Non-sterile medical equipment, tools that aren't cleaned properly between use can spread the virus. Blood or cutting rituals. Sharing the tool or exchanging blood can transmit hepatitis C. Medium risk activities include sharing or not disposing of grooming and hygienic supplies. This includes razor toothbrushes, nail clippers, or anything else that could have your blood on it. Cover any open wound or sores with bandages. or bandages. Carefully dispose of tampons, tissues, used bandages, and anything else that may have your blood on it. Unprotected sex. It's rare, but you can spread and catch it from sex, especially during menstruation or certain sex practice like fisting. It's more likely you will spread it if you have HIV or any other sexually transmitted infection. Pregnancy and birth. There is a small risk for a mother to pass the disease on to children before or during birth. The odds go up if the mother has HIV. Needle stick injuries. Healthcare workers and caregivers are most likely to get it this way. Things that don't spread hepatitis C. It can't be spread through coughing, sneezing, hugging, kissing, breastfeeding, unless nipples are cracked or bleeded, sharing unstyle or glasses, casual contact, sharing food and water, mosquito or other insect bite. That means everyday contact isn't risky. The odds of it spreading between people in a household are near zero. What are the chances of getting hepatitis C from sex? Hepatitis C can spread through sexual intercourses, but it's rare. And it's extremely rare among the monogamous couple. In fact, the CDC considered the risks of sexual transmission between the monogamous couple so low that it doesn't even recommend it using condom. Also, there is no evidence that hepatitis C is spread by oral sex. But you should avoid sharing razor, toothbrushes, a nail clipper, and sex during menstruation. If you have HIV or if you have multiple partners, you should take precaution. Using condom will protect you and your partner. Who are at the risk of hepatitis C? You might be more likely to get it if you inject or have injected street drugs, were born between 1945 and 1965, got clotting vector concentrated made before 1873, received a blood transfusion or solid grain transplant before July 1992, got blood or organ from a donor who tested positive for hepatitis C, are on dialysis, are a healthy care worker who might be exposed to needle sticks, have an HIV infection, when born to an infected mother, are in jail or prison, use intranasal drug, get a body piercing or tattoo with non-sterile instrument. Can you be reinfected? Yes, I have been reinfected and cleared the virus, or you have been treated and cured. You can get the virus again. Can you be a blood or organ donor? You can't give blood if you currently have symptoms or have ever tested positive for the hepatitis C, but you can properly donate organ or tissue. Since risk of transmission is low and hepatitis C is curable, while the odds of passing on hepatitis C are low, you should still tell anyone at risk that you have hepatitis C. You should tell sexual partner and family member. Your infection may be difficult to discuss, but anyone at potential risk must know. That's why they can get tested and treated it if needed.